So talking about headache as a main symptom, that patients that have diseases related to the neurological disease, to the neurological system, will present with in the clinic. Okay, so if somebody presents to the clinic and the person is trying to like tell you that headache is the main thing that brought them to the clinic, how can you be able to take proper history for this headache? Okay, so there are basically some questions that you have to ask the patient, okay, that will help you take a proper history of this neurological disease, okay, and to further on help you to actually like know how to make your diagnosis, right? So history taken for headache as a symptom of neurological disease, and we on. Let's move, guys. These are the types of headaches. You don't need to worry about this. I have a different lecture coming on the types of headache, all right? Various sites of headaches, okay? So by the time you are watching this video, probably I've already made that video. So you just comment, hey, drop the video to types of headaches and I'll make it available. So headache in general is a common neurological symptom, okay? So you have to learn how to take proper history of headache. So headache could be primary, it is just headache, or it could be secondary, okay, that means it's related to other pathologies. So something actually led to headache. Okay, if you have meningitis, if there's inflammation of the meninges, it can also lead to headaches, all right? So now this headache is because the meninges were inflamed. Do you understand? That's a secondary reason of headache, right? Still another picture showing the types of headache. Don't worry, I have a video coming on the types of headaches, all right? Then these are the main questions you should ask during history taking for headache. I'll be listing it, we'll define it, and I'll tell you what I know about it, okay? From my practicals at the hospital, I'll tell you how I actually went about it. For the headache, you try to know the radiation, okay? The headache is starting at one particular point, then is it moving to another point over time? That's radiation, all right? And you could see that the radiation could be to the neck or it could be retro-orbital. Okay, it could be that the headache is starting here and it's coming down to the neck. You're feeling some pain at the neck. Okay, normally the headache starts, then you start feeling pain. All right, that's radiation. The retro-orbital has to do it around the eye. You're feeling so much heat, so much pain around the eye. That's the radiation. All right. So you try to ask the patient, this headache is which side? They'll point it. So when you feel headache this side, do you still feel pain at another side, or do you still feel headache at another region of the head? All right, that's basically radiation. Then character, that means you are trying to ask them, how is the headache? Is it throbbing? Okay, is it pulsating? Do you feel like something is hitting you? Is it thunderclap? Is it, or you asking like on the scale of 10, rate this headache, all right? Some people might even exaggerate and be like, oh, it is 15 over 10, all right? But just know. Okay, so that's the character. Try to know which type of headache. Well, I feel this is where the headaches come from, all right? Okay, try to know the region. That's the character. Try to know the site of the headache. And I have a video coming on the site of headache already. So severity, you're trying to actually know like using pain severity scale, the patient to tell you on the scale of 1 to 10. I already spoke on this, right? On the scale of 1 to 10, how can you rate this headache? So from then I try to see you now from your knowledge. Don't ask them if it is mild, moderate, or severe. No, just ask them to rate it, okay? Then from your knowledge, you get to record if it is mild, moderate, or severe. Duration. How long does this headache last when it comes through? Okay, is it just a fast thing or does it last for so long? Okay, the frequency and periodicity, is it just like an alarm? Is it this headache that always wakes you up from sleep, or is this headache always in the afternoon, or is this headache always when you walk, or is this headache always in the evening? Is this headache always in the morning? Do you understand? That's the frequency and periodicity. Then aggravating factors. When you are having this headache, is there any other thing that if it happens around you, it tends to like trigger this headache more? Okay, those are the aggravating factors. Or is there something around you that when it happens, it actually starts this headache, all right? And it could be noise, it could be bright lights, and bright lights is mostly in migraine headaches, right? You see, migraine headaches is to the side of the head coming to the front of the eye. I have a video on types of headaches. There's a site of headache. Relieving factors. When you have headache, when you like take up some drugs, or maybe take out some foods, do they actually relieve it? So you try to know. Then associated phenomenon, it could be aura. Then what do you do during the headache episodes? Is it that you seek a dark, quiet room for rest? And that's mostly in migraine headaches, right? If you're having migraine, all right, you could just seek for a quiet, dark place to just rest and to go away. All right. Or when you are having headache, are you agitated and restless, such as in cluster headache? So where is cluster headache? This is cluster headache, and this is like to this region. Okay. So cluster headaches, bro. Cluster headaches. Cluster headaches, you'll be restless, you'll be agitated, there'll be too much energy in you. Okay. So guys, see this is cluster headache. This is sinusitis, basically headache from the sinuses. Then this is migraines. All right, this is tension. This is TMJ headaches. This is what neck headaches. Okay, this is hormonal headaches. This is stress headaches. All right, I have a video coming on the different types of headaches. And I think on the last slide, let's talk about nervous diseases that could cause headache. We have migraines, we have meningitis, we have brain tumor, we have subarachnoid hemorrhage, we have tension type headache. Okay, other diseases that could cause headache, we have sinusitis, we have earache, we have glaucoma. Okay, so guys, this is it about history taken for headache as a symptom of neurological disease. All right, see you guys in the next lecture where I'll be talking about the different types of headache. That's the site of headache and basically the condition that will be related to it. Okay, so that's it, and see you guys in the next area. Bye for now.